Are you tired of that nagging ache in your shoulder when you reach for something on a high shelf? Or maybe it's the sharp twinge in your lower back that stops you from enjoying a simple walk. Joint pain can feel like a constant battle, making everyday activities a real challenge and dimming your quality of life. Many people believe that to fix a painful joint, you have to push through the discomfort with tough exercises. But what if I told you there was a smarter, gentler way to get you moving again without any of the ouch? A method where pain is not part of the plan, but a signal to stop and adjust. Imagine a treatment that feels more like a helping hand than a struggle. This is where the groundbreaking work of a visionary physical therapist from New Zealand, Brian Mulligan, comes into the picture. Back in the 1980s, he noticed something fascinating. Some of his patients weren't getting better with traditional methods. Instead of giving up, he started experimenting. He wondered what would happen if he applied a gentle, hands-on glide to a joint while the patient tried to perform the very movement that used to cause them pain. The result was like magic. The pain vanished, and the movement was restored. This discovery became the foundation of what we now call the Mulligan concept, a revolutionary approach to manual therapy. What makes Brian Mulligan's techniques so special is this simple yet powerful idea of mobilization with movement, or MWM for short. Unlike other treatments where you might lie passively while a therapist moves your joint for you, the Mulligan concept is all about teamwork. You, the patient, are an active participant in your own healing journey. The therapist provides a specific, pain-free directional push or glide to the joint, correcting a tiny positional fault you might not even know you have. While they hold that correction, you actively move the joint through its range. It's a beautifully simple partnership. The core philosophy is a game changer. The entire process must be completely and totally pain-free. If you feel even a hint of your usual discomfort, the therapist immediately changes their hand position or the direction of the glide until the movement feels smooth and easy again. This no pain, all gain rule is what sets the Mulligan concept apart. It repositions the joint and retrains your brain to understand that movement can be safe and comfortable again. This immediate feedback helps your body relearn its proper movement patterns, leading to lasting relief and restoring your confidence to move freely and without fear. So how does this remarkable technique actually work in a therapy session? It all comes down to a few key principles that make it both effective and safe. First and foremost is the principle of active patient involvement. You are not just a passenger. You are the driver of your recovery. The physical therapist is your expert co-pilot, providing the necessary guidance. They will ask you to perform the specific action that has been causing you trouble, whether it's lifting your arm, turning your head, or bending forward. Your movement is the engine that powers the therapy, making it a truly collaborative and empowering experience for you. The second core principle is the therapist's essential role in providing a sustained, gentle push, which we call an accessory glide. Think of your joints like a door on a hinge. If the hinge is slightly out of alignment, the door will creak and get stuck. The therapist's hands act to gently realign that hinge, holding it in the perfect position. While they apply this pain-free glide, you are able to swing the door, your limb, open and shut smoothly. This glide must be perfectly angled and sustained throughout your entire movement, ensuring the joint tracks correctly and without any of that familiar pain you came in with. The third principle is the non-negotiable rule of being pain-free. I can't stress this enough. If there's pain, the technique is not being applied correctly for you, and your therapist will immediately adjust. This is crucial because it helps to break the cycle of fear and muscle guarding that often comes with chronic joint issues. When your brain learns that a movement no longer hurts, it allows the surrounding muscles to relax, which further improves your range of motion. This positive reinforcement is key to making the improvements stick, helping you regain function faster than you might think possible. To make these techniques even more effective, therapists sometimes use special tools to help them apply the perfect pressure. You might see them use a mobilization belt, which looks like a sturdy strap. This belt can be used to apply a sustained glide to larger joints, like those in your hip or lower back, freeing up the therapist's hands to better guide your movement. It allows for a consistent and firm hold that might be difficult to maintain manually. These simple tools are just another way the Mulligan concept ensures the technique is applied with precision, helping you get the best possible outcome from every single session. Let's talk about how this works for real problems that so many of you face every day, starting with that all-too-common shoulder pain. One of the frequent culprits is supraspinatus tendinitis, an inflammation of a key rotator cuff tendon that makes lifting your arm out to the side feel agonizing. Traditionally, this can be a stubborn condition to treat. However, recent research is showing just how powerful the Mulligan method can be. A 2023 study published on ScienceDirect.com looked at patients with this exact issue. What they found was truly exciting and gives new hope to anyone suffering from shoulder pain. The study divided patients into two groups. One group received standard physical therapy, including exercises and ultrasound. The other group received the same standard therapy, but with the addition of Mulligan's mobilization with movement technique. The results were crystal clear. The group that received the Mulligan MWM technique showed significantly greater improvements in media group, patients smiling with reduced pain, therapists showing progress chart at distribute _equally, pain reduction, disability scores, and their ability to lift and rotate their arm. Even better, when researchers followed up with them a month later, these fantastic results were still holding strong. This tells us that Mulligan isn't just a temporary fix. It creates lasting change. Now, let's move down to the lower back, another major trouble spot. Many people suffer from something called lumbar facet joint syndrome, where the small joints connecting your vertebrae become stiff and painful. This can make simple acts like bending or twisting a painful ordeal. For this, therapists use a Mulligan technique called Sustained Natural Apophyseal Glides, or SNAGs. While you stand or sit, the therapist uses their hands or a mobilization belt to apply a gentle forward glide to the painful segment of your spine. As they hold this glide, you slowly bend or move in the direction that was previously painful. The effect is often immediate. Patients who walked in wincing are often able to bend forward and touch their toes without any pain at all during the very first application. Research published on ResearchGate has compared Mulligan snags to other manual therapies like the Maitland technique. While both approaches are effective, the active involvement of the patient in the Mulligan method often leads to quicker feedback and faster gains in movement and confidence. By actively participating in the pain-free movement, you are essentially reprogramming your body and mind to accept that the movement is safe again, accelerating your path to recovery. One of the biggest questions I get about any new treatment is it safe? When it comes to the Mulligan concept, the answer is a resounding yes, and its safety is built right into its core principles. The absolute insistence on pain-free movement is its greatest safety feature. Pain is your body's alarm system, and this technique respects that signal completely. If a movement causes any discomfort, the therapist stops and finds a different angle or approach. This prevents the aggravation of injured tissues and avoids the muscle guarding that can make conditions worse, making it one of the gentlest manual therapies available. Furthermore, scientists are always looking into the broader effects of these techniques on the body. A fascinating study from 2024 published in the prestigious journal Nature investigated whether mobilization techniques related to the Mulligan concept, specifically those involving the sciatic nerve, had any negative impact on a person's balance or the pressure distribution in their feet. The findings were very reassuring. The study concluded that these gentle mobilizations did not cause any significant changes to static balance or foot mechanics in healthy adults. This means you can improve your flexibility and range of motion without worrying about it throwing other parts of your body off kilter. The popularity of Mulligan techniques among both physical therapists and patients is easy to understand. For therapists, it provides an effective and logical system to treat joint problems with immediate, observable feedback. For you, the patient, the experience is empowering. Instead of being a passive recipient of treatment, you are an active partner in your own healing. Seeing and feeling a painful movement become pain-free in an instant provides incredible psychological relief and motivation. It builds your confidence and helps you trust your body again, which is a massive step toward a full recovery. Ultimately, the Mulligan concept offers a common-sense, effective, and safe pathway back to a life of pain-free movement. By focusing on teamwork between you and your therapist, using gentle glides to correct joint mechanics, and making an absolute commitment to avoiding pain, this method unlocks your body's incredible potential to heal itself. If you've been sidelined by joint pain and are looking for a treatment that is both gentle and powerful, ask a qualified physical therapist about the Mulligan concept. It could be the key that finally unlocks the door to moving freely and living fully once again.